Hi everyone, very good afternoon guys. I hope I'm audible and visible to all of you, and welcome to this 4-day, I would say a marathon in a way, where we are going to discuss two subjects. Just a small request before we begin, listen to me for 2 to 3 minutes today so that you know what you're going to do for the next 4 days. These are the 4 days that we are going to meet on, and every day the timing pretty much remains the same. The session from my side prepared is roughly 2.5 hours, plus minus of course 30 minutes, plus ही होता है, it's never minus, but that depends on live interaction and doubt solving. Now today we are going to start with systemic path, tomorrow will be general path and hemat, that is how I've divided. For microbiology also, when the time comes, I have divided it depending on how much we can cover in that stipulated time frame, and we are actually going to cover that accordingly. So today the plan is of course systemic pathology. Every day what I'm going to do, I will be showing you a checklist. Now you can say 90% of this checklist I will be teaching you in LRR itself. 10% of course some things here and there from other subjects, but broadly in the last minute revision, when you're in the last week and you want to brush up some topics of every LRR, this is a checklist that you will be seeing, which will make sure that you have covered. Just put it in front of you and keep ticking it that I have done all these points. This means I am ready for the exam. So today's topic is systemic pathology. Today's checklist is right in front of you. So that way you won't have to ask me, ma'am, give us a list of volatile topics or give us a list of important things. That checklist will be given every day depending on the topics that we are studying. Now before we begin, of course today's class is going to be a mixture of everything. So there are some tables, there are some images, there are some MCQs. Some people have attended the April-May LRR, so yes, so many things from those are included here. Something extra has also been added here. So if you've attended that, then this session will be useful for you. Just a small request, there is a thumbs up button which is there in this chat box, but it is not something that you have to use just for fun, because the reason being that that button tends to put in so many thumbs up emojis over there, and then what I have to read from you guys, which is your queries, your doubts, your problems, that I will miss out on, and we don't want that. So we will use the chat very judiciously. We will use it only for we are not here for some clickbait YouTube session where the number of likes are going to matter. ऐसा कुछ नहीं है, okay? So we are only going to focus on answering what I ask you, MCQs, answers, and whatever you want to ask me. Is that okay with everyone? So we are good to go. Can we start with today's session? If everything is well, audio, video, screen, sab theek hai. So now we are good to go. All of you are very used to listening to me at 2x. So that means that now I, being a human being, I am talking very normally at 1x speed. That means that if I just increase my speed naturally as a human being, if I can increase it to 1.5x, usse zyada to humanly I can't do it. But I think everyone will be very comfortable because you are anyway used to listening to me at 2x. So 1x pe to I will sound like a very dead human being, matlab totally down and out and dead. So I don't want that. We will take a midway somewhere, that is 1.5x. Okay, very good. Let's start. We are starting with the first topic, which is a surgery pathology integration. We have the most likely diagnosis in a 48-year-old man who has a raised, red and exquisitely painful subungual lesion on the left ring finger, and a skin biopsy has been mentioned somewhere over here. There are round cells and there are some vascular spaces. Most of you have given the answer of glomus. Now there are two very classical points which tell you about glomus tumor. One more thing, in this PDF, a lot of things I have written beforehand. The reason being so that we don't waste time and we can cover maximum possible within 2.5 hours. I don't waste time in writing. So when I'm talking about glomus tumor, which they will definitely ask you in surgery and pathology integration, two buzzwords over here. Sabse pehle, patient will come to you with a lot of pain, excruciating pain, exquisite pain, next level degree of pain will be mentioned. And second, below the nail bed. Below the nail bed, you can see over here subungual. So that is a glomus tumor. And you need to know just this much. Painful hai, it's on the finger or the nail bed, that's glomus. Let's pick up the next question. PDF will be uploaded on the app only as soon as the class is over. I have never hidden PDF. You guys know me by now. So within 10 to 15 minutes, the PDF will be uploaded on the app itself. Don't don't worry, annotated PDF will be uploaded. Okay, coming to the next question. We are still on somewhere to do with vascular tumors. I've got some surgery pathology integration today because today you've also got surgery class in the evening at 5:30. So what is cystic hygroma? It is a manifestation of which type? And this is something which I'm waiting for an answer. Okay, I've got B as an answer, which is A and B में confusion चल रहा है. At least any of you who said that अच्छा lymphangioma है, you are on track. 50% story solved. Which type of lymphangioma? Firstly, you need to know that cystic hygroma is a tumor, and this tumor occurs on the neck. So that is in the neck. It can occur in any person, but it is very commonly seen. Who will tell me with which chromosomal abnormality? It's a general pathology, systemic pathology integration. Cystic hygroma is seen in the neck. It's a vascular tumor. It is seen and associated with Turner syndrome, 45XO, and this is a kind of a cavernous lymphangioma. That is the correct answer that you have. So please note, lymphangioma tells you it's a lymphatic channel problem. Capillary lymphangioma will tell you the lymphatic channels are very, very small. So the lymphatics are very small, that is capillary size. Cavernous will tell you that the lymphatics are very, very large. So cystic hygroma is large lymphatics seen in the neck and seen in Turner's. Other than this, cystic hygroma has no other questions. Question number 1, it can occur on the neck. Question number 2, it's a cavernous lymphangioma. And question number 3, it's seen in Turner syndrome. Khatam. After this, the topic is done. Let's move on to the next question. Another general path surgery and systemic correlation. Which of the following substances is not associated with the development of angiosarcoma? For all of those who are wanting the PDF on Telegram, I mean, Preflatter is not, posting the PDFs on Telegram, but I don't have to say, and I think it is kind of understood कि मिल तो जाएगा ही कहीं ना कहीं से. All said and done. So when I say angiosarcoma, not a risk factor. For angiosarcoma, yes, very good. And we know that usually the angiosarcoma that they ask you, I have made the liver over here, and we had always learned in rapid revision, liver की वाट लगानी है, तो liver में VAT chemicals use कर लो. What are the VAT chemicals? V for vinyl chloride can cause angiosarcoma, arsenic can cause angiosarcoma, and thorotrust can cause angiosarcoma. Which cannot cause is going to be formaldehyde. Now this is not how direct a question will come to you. थोड़ा सा इसमें modification होगा. Firstly, are all three chemicals required? No, either of the two, either vinyl chloride or arsenic or thorotrust. Third, next question is that where will they come from? So vinyl chloride comes from polyvinyl chloride, which is actually nothing but plastics. When we get plastic, and we are exposed to plastics every day. Arsenic is something we are getting exposed to in pesticides. That's why they say wash your fruits, vegetables, because उसमें pesticides है. And thorotrust is a metal, that is thorium. Trust is something which is used in radiology, that is a contrast dye, and that can cause angiosarcoma. That is why now radiologists don't use this contrast dye. These three chemicals can cause angiosarcoma of the liver. Okay, PDF की टेंशन मत लो, जैसा बोलोगे वहाँ पोस्ट हो जाएगा. अभी your focus should not be how will you arrange the PDF. At least with me, you should not be worried about it. PDF का कर लेंगे. Wherever you say, I'll post it. अभी your focus should be 2 hours of only studies, concentrated, filtered out study without any tension of exam, MCQ, PDF, notes. वो सब भूल के this is your 2 hours, 2.5 hours of meditation session. ठीक है? बाकी whatever you say will be done. Fine. Now that you've spoken about all these kinds of different tumors, please note there is one more question that comes जो मैंने सिर्फ buzzword लिख के बताया है. HIV positive patient में skin tumor कौन सा सोचोगे? और कुछ पढ़ना ही नहीं. HIV positive patient, which basically means I'm talking about an AIDS patient, and that patient has a skin tumor. What kind of skin tumor, ma'am? It is a red color tumor. Red color tumor tells me something to do with vascular lesions. Yes, that is going to be perfect. Kaposi sarcoma, and Kaposi sarcoma is caused by which virus? Microintegration. It is caused by human herpes virus 8. Day after tomorrow we will study human herpes virus 8 belongs to DNA virus family. Very, very good. So tell me something more. Till the time it's like a viva. Examiner will keep asking you till you stop answering. So you've answered this, I will ask you more. What is the most common site of Kaposi sarcoma? Obviously the one that is mentioned, that is skin. But if I ask you which is the second most common site of Kaposi sarcoma, now your answer is going to be lymph node. Very, very good. Why have I got this question? Because in the last exam it was asked that Kaposi sarcoma that occurs in HIV/AIDS occurs at which CD4 count? Because HIV/AIDS में तो CD4 count पे question पक्का है, which I will teach you when we go to virology and microbiology. But now listen to me very carefully. as per the textbooks, and ये last time था ना in the June-July exam, this was the most controversial question that came. So listen to me extra within 2 minutes. CD4 count, as per books, it says Kaposi sarcoma can occur at any CD4 count. Any CD4 count that is written in the books, including Harrison, including pathology, any CD4 count. But the question asked in that exam was Kaposi sarcoma typically occurs at which CD4 count? वो तो कभी भी सकता है, it can happen at any CD4 count, but typically occurs. Many of you have marked it as less than 200 exactly. So read the question carefully. There's just a way of asking. Kaposi sarcoma can occur at which CD4 count? It can occur anytime below 500, but typically occurs around which CD4 count? Typically, of course, as you keep going down and down, obviously the chances will increase. So now this is how you will have to read the question and you will have to assess how it's going. So Loni is saying that there's a problem in the audio, but I can't visualize that. Is there any issue with anyone else? Because from my end it seems to be fine. So Loni, you can probably just reconnect once, or you can try using some headphones. Maybe that should help, right? Okay, audio ठीक चल रहा है. चलो, all this is done, and this is the reason I taught you Kaposi's, because something variation of it will also be asked. आगे चलते. Let's move on to a little lengthy question, because in your exam some will be one-liners, some will be medium, and at least every set will have 4 or 3 questions which will be ज़रूरत से ज़्यादा lengthy. This is that question. So you have a 20-year-old woman who's complaining of double vision, fainting spells, tingling in the left hand, numbness in the right hand. Overall body में ना visualize करना start करा करो. Whenever you get a clinical question, think of a patient and a human being in front of you. उसमें point करने लग जाओ that okay, this is a human being in front of me. I know you all know the answer. You've taken up that buzzword, but exam में इतना easy नहीं होगा ना. You won't be having a bias that this is a pathology question. It could be surgery, ophthalm, ENT, anat, anything. So just start imagining that whatever is happening in this person is happening upper limb की तरफ. Okay, physical examination shows absence of pulse. I know this is the buzzword, pulseless disease. It has to be Takayasu arthritis. But in the exam, even if you are 100%, 200% sure question, छोड़ के नहीं आना, पूरा पढ़ के आना. Now tell me, Takayasu arthritis, which you're calling as the pulseless disease, that has a problem in which artery most commonly? So aortogram shows you narrowing of the artery. Most commonly it is the subclavian artery, so that is coming in favor of it. Now I know that yeah, this is a Takayasu arthritis. Takayasu comes under what? Large vessel, medium vessel, or small vessel? Jaldi say, let's keep today. I'm also teaching you not just LRR, I'm teaching you time boxing technique. अब से लेके for the next 50 days, you have to work in time boxes if you want to do 2 to 3 revisions of your syllabus. Means आपको decide करना पड़ेगा. 2 days I have to finish pathology. You tell your brain you have to finish it in 2 days, your brain will finish it. You tell your brain that you have to finish it in 10 days, then your brain will sit and relax and finish it in 10 days. So today I'm telling you, you have to finish the entire topic of this vasculitis will be in 10 minutes. हमारे पास एक 10-minute target है, topic खत्म करना है, and I can guarantee our brain and your brain will finish it in 10 minutes. So very good. When I talk about Takayasu, we have large vessel vasculitis that we are talking about. What all comes under large vessel vasculitis? The 2 T's come under large vessel vasculitis. Takayasu arthritis and temporal. Before I start, in medicine they will ask me कौन सा classification है, large, medium, small. What is the name? Because in medicine they like to ask you. That is going to be Chapel Hill classification. Exactly. These fancy names, 1 or 2 of them come. Of late थोड़ा कम आ रहा है, but you never know why when it makes a comeback. Chapel Hill classification. So Takayasu arthritis, as all of you are saying, is involving the arch of aorta. दिख रहा है. And it is most common vessel. I just now told you it is the subclavian artery. Tell me the other thing. Which is the least common vessel affected? Subclavian artery, so okay. The least common vessel affected is going to be the coronary artery. That is also these days na most common. Se ye log thak gaye, they are bored. They started asking you questions of least common. Okay. Now obviously if the subclavian artery is affected, so then pulse is going to be very weak. Pulseless disease. This typically occurs in age less than 50 years, because above 50 years पे क्या होता है? Age above 50 years, when the patient becomes giant and old, तो giant cell arthritis होता है. Giant cell arthritis is temporal arthritis. Obviously, tell me these 3-4 questions. इसके बाद कुछ नहीं आएगा. Temporal arthritis, which is the most common vessel affected, which is in front of you, ma'am? It is of course the temporal artery. It is the superficial temporal artery. Common sense. Very simple. If person has a temporal artery over here, now they will go into medicine. They will ask you what will be the kind of headache. It's not going to be a frontal headache. It's not a medicine wala tension headache nahi ho raha. It's temporal artery. The headache is also going to be here only. It is going to be a unilateral headache, and which is very, very severe. Plus, you will see that, okay, there is some kind of a nodular swelling. So what are you going to do? You are going to do a biopsy. How many centimeters of biopsy in medicine have you been taught? Pathology books में बोला जाता था at least 1 centimeter, but medicine books which you have to follow for this say that at least 3 to 5 centimeters का तो lesion का biopsy you will have to take. 3 to 5 centimeters you will have to take, and after 3 to 5 centimeters, because the name is giant cell, obviously what you're going to see is giant cells and granuloma. So jaldi se a quick zoom into this picture. You will see these giant cells, and that is why giant cell arteritis is there. But now they are also asking you that all of this is to do with temporal. What about other things? Which is the most specific symptom? Very good, it is jaw pain. Jaw pain matlab jaw claudication. They will not write jaw claudication. They will write jaw pain, or they will write mandibular pain. Same thing. But now comes the most important thing, which is the most dangerous symptom that the patient can have. Alert for the doctor, alert for the patient, is going to be loss of vision. Blindness हो जाएगा तो problem है. तभी what are you supposed to treat the patient with? Very good, it is going to be steroids. So the next medicine question comes. If a patient comes to you with this kind of a headache symptom, two options you have. What will you do next as a doctor? Will you start the steroids stat only based on clinical suspicion, or will you wait for the pathologist to give you the report? Remember, start the steroids stat. Don't wait for the report. What if the report comes after pathologist gives the report after 2 days? In that duration, patient ko blindness ho gaya. How will you get vision back? Then it's gone forever, right? So start steroids stat only based on clinical suspicion. Start the steroids. So Chapel Hill classification, large vessel में दो आते. Temporal Takayasu. This was a case of pulseless disease. So obviously you had Takayasu arthritis. I know obviously the next one is a biased thing. तो इसमें तुम कुछ पढ़ो ही मत. Obviously you are seeing something which is giant cells, and उसके बाद तो you are not bothered because this is giant cell arthritis. But abhi you told me giant cell arthritis occurs in giants above 50 years. So this is a 70-year-old woman. And of course, because most common symptom is going to be headache, most specific symptom is going to be jaw pain, most dangerous symptom is going to be vision pain. सब कुछ fit हो रहा है. And there is involvement of the temporal artery plus giant cells. अब मतलब it's like all of you are very scared now. Lengthy questions, मैम बहुत time waste होता है. Let the examiner talk. देखो, जो जितना बात करेगा ना, वो उतना ज्यादा आपको secrets reveal करेगा. The person who talks more will reveal more secrets. So if the examiner is talking so much, he will end up giving you more hints. Whereas if he writes one line, then you will have to use your brain कि अच्छा what is the answer. Over here, let the examiner talk. Don't be scared of lengthy questions. चलो थोड़ा सा आगे बढ़ते हैं, because this was अभी what I'll do, I'm not asking you questions. You just told me large vessel vasculitis, तो जल्दी से बता दो what comes in medium vessel. I mean, no one is ever forgetting it. We know the famous mnemonic of pan khata bachcha, right? So these are the three things that come under it. First, you tell me out answers, and then I will get you to questions. Pan khata bachcha is polyarthritis nodosa. My gut feeling says something to do with polyarthritis nodosa might come in the exam. A very vague gut feeling जो अभी आई है. So what is the viral marker? Remember, it is associated with hepatitis B surface antigen. It will not be written as hepatitis B surface antigen. In microbiology, this is known as Australia antigen. So PAN is associated with it. It is medium vessel vasculitis, right? So the most common vessel affected is the renal vessel. But renal vessel means what? Patient को क्या होगा? Ma'am, renal vessel means blood in the urine will come. Now the problem is that as soon as you feel कि oh blood in, a patient walks into your OPD and says, doctor, I'm having blood in the urine since 5 days or 10 days or 14 days. As soon as he says blood in the urine, you say kidney में problem है, glomerulus में problem है. You tell me, is this a glomerulonephritis or is this a vasculitis? So this means this is a vasculitis. It's a renal vein problem. Is there any glomerulonephritis? No, the blood is not because of glomerulonephritis. Which is the vessel spared? I think ये तो वैसे भी कोई नहीं भूल रहा. That P is not for P is very famous. What is not involved in pulmonary is not involved in PAN is pulmonary artery is never involved. Now who will tell me the necrosis? जब भी I have taught you polyarthritis nodosa, all 3-letter things have which necrosis? That is going to be fibrinoid necrosis. मुझे ऐसे लग रहा है that I am probably teaching my own self. because the kind of answers that everyone is giving, I am actually feeling that I am teaching my own self. Whatever I'm saying, wo chote se hint pe everyone is coming back, which gives me a lot of satisfaction that everyone has watched the rapid revision so many times and has actually gone through the same content again and again and again. क्या बोले पूरा flow में वैसे का वैसा, you have learned it like me. So someday if I want to take a break, I can tell one of you to take the LRR session. वो same flow में all of you will start off with it. Okay, now done with PAN, we go on to Kawasaki. If PAN does not come in the exam, I think Kawasaki will come, because Kawasaki also came in the recent NEET PG 2024. So something variation of this will also come. Kawasaki curve for kids. This is the vasculitis which will be seen in a bacha less than 5 years, in whom fever will be more than 5 days. Bacha less than 5 years, fever has to be more than 5 days. Plus there is something known as a cream criteria, 5 alphabets, out of which at least 4 have to be present to call it Kawasaki. Now this question came in the NEET PG exam, so dhyan se sunna. They asked you, C for what? Conjunctivitis. They asked you which kind of conjunctivitis. Firstly, both eyes. Mother, chota bachcha na, 5 years ke kam ka bachcha. Mother will come and say, look, my bachcha's eyes are red. Both eyes are red. So obviously child has conjunctivitis. But this is what was asked. It is non-purulent conjunctivitis. Now the purpose of non-purulent over here is bacteria nahi hai. That's not a bacterial conjunctivitis. So there is no pus. You will ask the mother that is there any pus coming out from the eyes? She will say no. This non-purulent word was asked in NEET PG. Coming to the next, it is going to be rash. Third, the child will have swelling, that is edema. Fourth is lymphadenopathy. Now this is what they will ask you next. Unilateral lymphadenopathy occurs and it is in the neck. So please remember, eyes dono red hoga and lymph node only on one side. Finally, M for what? Mucosal involvement. Mucosal involvement means strawberry tongue. Before I proceed, where else do you see strawberry tongue apart from Kawasaki disease? It is also seen in scarlet fever. I will teach you scarlet fever when I go to microbiology, but jaldi kuch bata do. Scarlet fever is because of, I'm not writing it because baad mein likhna hi hai. Scarlet fever is because of which bacteria? It is because of streptococcus, hai na? So now scarlet fever can also have rash, scarlet fever can also have lymphadenopathy, scarlet fever can also have strawberry tongue. Everything is overlapping. What are the differences? Scarlet fever is a bacterial infection. The lymph node will not be one side. The lymph node will be both sides because it's a bacteria. So scarlet fever will have bilateral lymphadenopathy. Scarlet fever ka rash, so you have anyway told me that ma'am in this there is going to be that sandpaper kind of rash. Very, very good. And strawberry tongue is also seen in both. So remember, in scarlet fever, sandpaper rash will be mentioned and bacteria hai the lymph node both sides. Coming to the pan khata bachcha, burgers. B for burgers, B for BD. This means some history of smoking will be there. And this question came in the last to last FMG exam, that what is the other name of burgers? They just asked you a simple word and that was TAO. Decode the word because aise nahi likha hoga. This is going to come as something different. What is thrombo? Thrombo means there's a blood clot. What is itis? Means there is going to be inflammation. Of course, angio means this is a blood vessel chapter, and obliterans means that the blood vessel has been totally obliterated. Ye agar blood vessel tha, it has been obliterated. So tell me, this person goes for a walk. He says, today it's a Sunday, I'm going to run a 10-kilometer marathon. Kya wo kar payega? Bilkul bhi nahi. There is going to be leg pain. Leg pain is written as what? It is written as leg claudication. That is what is going to involve. So now you will say artery involved hoga? Yes. You will say veins are involved? Yes. You will say, can nerves also be involved? Yes. Means everything can be involved. What is never involved? Who will tell me? In burgers, lymphatic channels are never ever involved. That's going to be a question. So medium vessel vasculitis ho gaya, pan khata bachcha, done. Who will tell me the questions related to this? I will now show you how the questions came. There was a 27-year-old male. देखो अभी थोड़ा bias है. Exam point of view से सोचो where it will be an open-ended question. Here you have a 27-year-old male. There are multiple complaints. Fever है, weight loss है, abdominal pain is also there, muscle pain is also there. Lab investigations reveal some kind of vasculitis. A possibility of polyarthritis nodosa is made. Which is the suspected diagnosis? Of course, it is going to be hepatitis B virus. As I said, this time they might not write it. They might write it as Australia antigen. I just feel they would want to test your knowledge on that. Another question, this is your repeat from the FMG exam. ये आपका PYQ है. What I have done, I have just made that PYQ a little lengthy. बस और कुछ नहीं करा. I have a 45-year-old man who has pain in the legs upon exercise and destruction of the fingertips. So lower limb is also affected, upper limb is also affected with a very strong history of smoking. जैसे ही स्मोकिंग पढ़ा यू से अच्छा ऑप्शंस जल्दी जल्दी देखते हैं, अच्छा ये तो वैस्कुलाइटिस चैप्टर पूछा गया, स्मोकिंग के साथ ओनली वन फिट्स बर्जर्स, दैट्स हाउ यू डू क्विक आंसरिंग. When you start getting buzzwords ना जल्दी, what you say retrospective doesn't mean पूरा question आप opposite पढ़ना start कर दो. Retrospective means quickly read the last line, okay they've asked for a diagnosis and ये जो chapter है this is medicine or path, narrow down your subject, it should take you 2 to 3 seconds. सब्जेक्ट नैरो डाउन करो, नाउ यू नो अच्छा वैस्कुलाइटिस वो वाले बज़वर्ड जो मैम ने बताए थे, सो यू स्टार्ट रीडिंग स्मोकिंग बर्जर्स डन. नेक्स्ट क्वेश्चन, दिस इज नोन एज प्रैक्टिसिंग क्वेश्चन, वो आपको डायरेक्ट एग्जाम में कोई ऐसा सुपर पावर्स नहीं मिलेगा, that you have to do right now with me. So moving on, as I said, the other name of Burgess is thromboangiitis obliterans. Do know, can you find thrombo? Yes, it is written. Can you find angiitis inflammation? Yes, it is written. Obliterans, I can see a blood vessel over here and ये blood vessel open ही नहीं है, पूरा भरा हुआ blood vessel है. It is all filled, it has been obliterated. Plus you said ma'am, arteries are also affected, veins are also affected, nerves are also affected. All of that is written in the question over here. So very good, this is also done. Let's move on to the next one and you can tell me the answer to this. This is a 3 times repeat PYQ. They love this disease in the FMG exam. A 6-year-old girl presents with a 2-week history of skin rash over her buttocks and there is also present of joint pain. Perfect ma'am, जैसे ही हमने पढ़ा buttocks and छोटा बच्चा. So which is the most common vasculitis in children is going to be Hinox-Schondlen purpura, buttocks, purpura, bachcha. Nothing else fits. But listen to me very carefully. Tell me something from point of view of I would say from point of view of pediatrics and dermatology थोड़ा सा. You are I will make you read this बाद में. अभी बताओ Hinox-Schondlen purpura. So there is a purpuric rash. They are saying there is a skin rash over the buttocks and they have mentioned there is palpable purpura. Any reason? What is palpable purpura and क्यों हो रहा है? Because Hinox-Schondlen purpura is because of deposition of what? It is because of IgA deposition. So please note, Hinox-Schondlen purpura, we always used to have that Bengali accent and used to call it Hinox-Schondlen purpura. तो उस पे तो हम आएंगे, but please remember that you need to know in dermatology the difference of different types of purpura. So palpable purpura मतलब you can touch. It's a red rash so everyone has had or everyone has seen. But if you can actually palpate that, that is something you see in Hinox-Schondlen purpura because it is due to some antibodies. It is antibody mediated. However, if you have a red color rash and you actually can't touch it, it's not elevated, you can't feel it, non-palpable, that is because of a decrease in the platelet count. Tell me a disease in which there is platelet count decrease, that is ITP. So ITP में जो rash होता है, that is non-palpable purpura. Versus the third one, where do you see pinch purpura? Means normally the skin is normal color, but pinch करा तो pinch करने पे it becomes red. Pinch purpura is seen in amyloidosis. Pinch purpura is a feature of amyloidosis. This is something which is utmost important in medicine and derma. Because on the basis of the purpura, you will narrow down your answer at times. Over here, palpable purpura was written because of course this is due to what? IgA. तो आगे बढ़ते हैं. Palpable purpura है. Next, ma'am, the patient had joint pain because A for what? A for joint pain, arthralgia. Also, there is going to be blood in the urine because R for renal involvement. There is hematuria that happens in the patient. If I read further, the kidney is of course gone. I can see सब कुछ बढ़ा हुआ है. RBC is coming. What is this? The stool GOAC test is positive. Firstly, stool का test है, तो मतलब मैम it is to do with the abdomen, and yes, there must have been some abdominal pain. That is why you've done a GOAC test. I have made you learn something about the GOAC test in the rapid revision. I mean, I shouldn't be using such words, but usually they don't mention stool. They say GOAC test is positive, and then you're wondering कि कौन सा test होता है. तो GOAC test is a test of, it's a test of the stool sample. It's a test of the feces. It's GOAC test has the name in it. And what are you testing in it? In this GOAC test, you are testing hidden blood. Occult blood is the test that you're trying to do. Means, see, if a person comes to you says that I am passing stool and in that I can see the blood, तो वो तो दिख ही रहा है ना. Why will you do a GOAC test? If a person comes to you saying that I am not passing any blood in my stool, I check every morning and my stool is totally bloodless, no blood at all, but still the person is having iron deficiency anemia, तो कहीं से तो blood is getting lost. Maybe little blood is getting lost which we cannot see with our eyes. So for that hidden blood, which is the test that you will do the GOAC test. So abdominal involvement was also mentioned. So purpura, abdominal involvement, arthralgia, renal, And what is the antibody? As all of you told me over here, the antibody is going to be IgA. Everything that was mentioned, IgA we mentioned that this is a case of Hinox Schönlein purpura, so it is settled over here. Why did I mention this? Because Hinox Schönlein purpura comes under small vessel. So large vessel में TT था, medium vessel में पान खाता बच्चा, small vessel has Hinox Schönlein purpura. And also the next last question of this topic. There is a 59-year-old male admitted to the ward with fever, arthralgia, weakness, cough, dyspnea, multi-organ involvement. I can see the